Selena Gomez plead with fans to put her in their prayers as she lament bitterly over a life-saving kidney transplant to treat lupus in June. "We break it all down for you, but before we do, please subscribe, comment, like and share." Actress and singer Selena Gomez posted on Instagram that she had a kidney transplant in June for lupus. In her post, she wrote that she enlisted her A-list friend and actress Francia Rasia to donate her kidney. "She gave me the greatest gift and sacrifice of donating her kidney to me. I am so blessed. I love your sister." Previously, in August 2016, Gomez cancelled the final day of her tour after her lupus problem caused similar anxiety and depression. "I wanted to do something for my normal health," she wrote in a new post. Gomez's friends and followers took to her Twitter account to applaud her for being open about her condition. Lupus is considered an invisible disease. Gomez, along with fellow singers and lupus survivors Toni Braxton and Kel Bryan, is one of many celebrities who have contracted the invisible disease in recent years. And just days before Gomez's transplant announcement, Lady Gaga has sparked controversy by tweeting that she has fibromyalgia, another invisible disease. Lupus is an autoimmune disease that causes inflammation. This condition is difficult for doctors to diagnose, and there are many signs and symptoms that can affect a person very seriously, as well as those that are exceptional. There are many types of lupus, but systemic lupus erythematosus, SLE, is the most common. And it directs the immune system to the kidneys, which primarily filter blood and waste products. Lupus nephritis usually begins within 5 years of the onset of lupus. This is one of the most serious disabilities of this disease. Kidney damage can also cause a variety of pain. Here are the symptoms that Selena Gomez may have experienced at some point in her lupus experience. Leg and foot swelling, high blood pressure, hematuria, dark urine, daily nocturnal urination, pain in the side. Lupus nephritis is an incurable disease. Treatment includes managing the condition to avoid permanent kidney damage. If the damage is extensive, a man or woman may need dialysis or a kidney transplant. Between 10,000 and 15,000 Americans undergo transplants each year. In the post, Gomez opened a personal account to publish information about lupus and advised her followers to contact the Lupus Research Alliance, saying, "Lupus is on the rise, but it is still very misunderstood. There is," she said. "How chemotherapy helps fight lupus and other autoimmune diseases. Also, low-dose chemotherapy for lupus. One chemotherapy drug used to treat lupus and rheumatoid arthritis is methotrexate. Many drugs used to fight autoimmune diseases have additional effects on other diseases, as all of these diseases are associated with an overactive immune system. Methotrexate is already being developed to fight cancer. During treatment, this drug can be administered intravenously or directly into intellectual fluids. However, proprietary documentation uses it differently to treat lupus and many autoimmune diseases. When methotrexate is administered to patients with rheumatic disease, it is usually provided in tablet form and at much lower doses. Significantly reduced dosage. Patients also receive much smaller doses of this drug, which has much less impact on their immune system. In the treatment of cancer, methotrexate is a potent immunosuppressant. However, in patients with rheumatic disease, it does not suppress the immune system as much as in most cancer patients. However, in severe cases of lupus, doctors may use additional capsules for chemotherapy rather than to fight cancer. Once patients develop neurological symptoms, such as seizures, stroke, and symptoms of myosclerosis, they end up taking stronger, incredibly powerful drugs that can reverse the effects of chemotherapy. "We tend to do that," says Blanco. However, treatment for lupus depends on the organ affected and its severity. Lupus affects different body types, and there is no single treatment, he says. "I take the pill mainly because I have a team of doctors who work with me to improve my medication regimen. It consists of several medications to treat lupus and overdoses of steroids every few months to treat recurrences of lupus." She also takes medication to treat comorbidities, such as respiratory illness, and to manage the daily stresses associated with her life-threatening illness. "I know it can be very exhausting at times, but I try to remember how sick I was before I was diagnosed. Thank you for watching, nice people. And let us know in the comments. Don't forget to subscribe and press the bell for